So spending, I completely agree, public healthcare needs to be there. All of this goes back actually to the question of how much fiscal expansion is the government willing to undertake now. So prior to the pandemic, there were already concerns about our debt to GDP ratio. Of course, during the pandemic, the government in Parliament increased the statutory debt limit. And, organizations like ours, of course, have always cautioned, be careful, right, the debt limit. But in times of crisis and in times of emergencies, so we've made the position that it is a good thing to have a fiscally an expansionary budget now. Okay, so once we take that position, now the next question is, where do we spend it on? But sorry, before that, I want to backtrack a bit. How are we going to finance this fiscal expansion? So if we see a large budget increase tomorrow that's being tabled in Parliament, that's much larger than the previous year or years, I think that's acceptable now. How we're going to fund that, I hope the government is transparent and accountable to the public, whether we're going to get it by borrowing. Are we going to get it by withdrawing more funds from the National Trust Fund, for example, that for the first time was withdrawn, right, by the way, about 30% of the fund? Or are we going to tax more of the Malaysians? So that's a tricky one. And if there's a tax, what kind of taxes are we willing to undertake?
But is it fair?
And is it fair
after this pandemic?
Exactly. Okay, but wait. But going into the expenditure part, okay, so this links back to your question about the endemic. So spending, I completely agree, public healthcare needs to be there. I think already we've seen that a lot of the hospitals not just were crying out for help in terms of equipment, but the resources were unfairly disbursed. So there were some hospitals that had more, and the systems were not built in such a way that these extra resources could be immediately allocated to the hospitals that required it. So we see a lot of horizontal policy miscoordination, actually, or just uncoordination throughout the entire country. The second big aspect is, if you talk about pandemic as an endemic, COVID-19 as an endemic, we also need to expect to have booster shots, perhaps every year, just like the influenza vaccines. And the government will need to take that into account. The Ministry of Finance has, a lot of headaches right now, I think, to finance, again, these booster shots. If you're thinking about it on an annual basis, how much is this going to cost the nation?
Kita yang tulus, kita yang tulus, kita yang benar, Sinar Harian.